With the flu season approaching, many may be wondering how will this affect an already challenged health system. Charles Fisher continues his conversation with a local pediatrician on immunizations.
The flu season is a problem within itself and has gone on for decades. And this now complicates another respiratory problem, which is COVID-19, which is basically spread the same way.
We will have to just take it case by case. We have a flu vaccine. We know that the kids can take the flu vaccine. We've always been ones to say, take the vaccine once you're not, sick or you can't take it. Also, with all these extra measures, hand sanitizing, improved sanitation, trying to eat healthier, all of these things, and wearing the mask now. We didn't do this in the past. This should help not make the flu season worse. But if people let their guard down and think they're going to go back to business as usual, it's going to be a problem for everybody. So I think it's a thing you just have to wait and see how it goes. But remember, you've got some stuff in place that wasn't there last year. Again, social distancing, the masks, hand sanitizing, washing your hands, and also emphasis on good nutrition. This is how we're going to fight this and every other virus.
Pediatrician Dr. Rochelle Williams says COVID-19 is just one of several hundred viruses that is respiratory spread.
We fight them all the same way as we're fighting this one, preventing respiratory infections, taking care of the sinus infections, not just letting the kid have a runny nose and think it's going to be fine. More aggressive behavior, taking care of that. You'll find that it will help. I can't guarantee kids aren't going to get sick.
Working out of the Pediatrics Association, but not speaking on behalf of all pediatricians, she has noticed a decline in immunization.
I've had to explain to parents that this is a part of dealing with this virus. MMR, measles, mumps, rubella. Measles is killing more people in the world than you think. And that's a preventable disease by MMR. We must make sure that our kids are up to date with certain vaccines. MMR should be done at least age first year. It used to be 4 to 6 when you get the second one. Now, because of an epidemic of measles worldwide, because people are not immunizing way before COVID, measles has been through the roof. So the reality is that make sure your child has had their 4 to 6 year measles shot. If they're under 4 to 6, if they're over 15 months, make sure you catch up, because a lot of times the kids fall in between the 15 months and the 4 years because they've already passed 15 months. But make sure they come for that. All of the other respiratory vaccines, the diphtheria, the acellular pertussis, and the polio, you need to make sure they get those as well.
So in reality, parents must be vigilant and continue with the vaccines.
No, it's not going to make the child's immune system worse. On the contrary, measles, mumps, rubella vaccine actually improves and augments all of the other vaccines the child would have gotten at age 2, 4, and 6 months. In other words, it makes it better. And they found this out because there are kids who are not being vaccinated. So what they did was they looked at the kids who were vaccinated versus those who weren't and see what their immunology, what their blood count looked like. And you found out that the vaccination actually made the vaccines for respiratory infections so much more effective. This is the only thing we've got, us fighting this disease. This is long going. It's not something that's going to happen overnight.
For the Morning Edition, I'm Charles Fisher.